Hi everyone, Dr. Emi from Pain Free and Fit. Today, a great video for those of you with degenerative, herniated, and bulging discs in the lower back. We're going to talk about an essential multifidus exercise to help stabilize your back and help prevent pain. Hope you enjoy. So if you've seen any of the other videos on multifidus training and degenerative, herniated, and bulging discs in the lower back, you realize that multifidus muscle is a key component to many people's lower back pain, especially with discs. Many research studies have shown a connection between multifidus muscle atrophy and inhibition and chronic lower back disc symptoms. So rehabbing and getting to make your multifidus muscle correct in its function as it relates to stabilizing your spine prior to movement and during movement is a key way to help prevent lower back pain, not only with sports and working out, but also in everyday activities. So with that said, we've discussed the multifidus, which are small muscles that come off each vertebra of the lower back. If you go to the center of your lower back, the knobs in the very midline, the spinous processes, at the very inferior bottom tips of each knob, right and left sides, there's a multifidus muscle that travels down and out several segments, and when it contracts, it holds the spine in a nice, safe position. When one multifidus is inhibited, meaning it doesn't contract as quickly as it should, or as well as it should, or it's atrophied, meaning it's shrunken down, it's lost muscle size and power and tone, that multifidus muscle is not going to stabilize the spine. So when you move, the spinal segment where you have your disc problem can tilt and can become irritated. The disc, remember, loves to have stability right and left side to symmetrically hold it in a position where it's not going to be excessively loaded. It gets loaded with a lot of pressure coming down, top to front. That's why things like heavy shoulder presses are irritating, prolonged sitting where the spine bends and flexes. And when we're doing things, when we're working out, when we're training, when we're even moving through life, if we don't hold ourselves in that unique neutral spine position that's custom fitted for all of us, then we're going to put more pressure on that disc. Now, if you haven't yet done a body analysis on yourself, go to the painfreeandfit.com website. We have a free body analysis. Figure out what your mechanical issues are, where your muscle asymmetries are, where your global patterns of movement, maybe hip hiking on one side or twisting on one side, you're stronger or more flexible to that side. Those things are going to happen when you move. Those are the problems that aggravate many disc problems, these mechanical flaws, these mechanical asymmetries. For me, I'm going to focus on igniting or lighting up, contracting my left multifidus muscle at L5 because through an analysis I found that's my weak spot. And then I'm going to challenge that today with a one-legged hip hinge, and I'm going to explain why that is. First, to engage the multifidus, I'm going to use the co-contraction technique of pulling my lower abdomen in, and that pressure I'm going to focus on coming out the left side of my lower back. I'm going to keep my thumb right against that knob at the very bottom tip on the left side at L5, and I'm going to feel that pressure engage as I put that in. I'm going to maintain that, and I can even hold my thumb there and maintain contraction to monitor to make sure that I'm still contracting that as I do this exercise. So the hip hinge, if you remember, is simply as we hold the neutral spine, core spine, we're going to tilt back and forth from the hip joint. We're going to allow the pelvis to roll on the femoral head or the ball of the thigh, and everything above that rolls as one unit. I'm not trying to bend from the waist. The key with this hip hinge exercise is maintaining that neutral spine. Now, neutral spine, again, is very different for all of us. For me, I'm going to use a little bit of tail under. For you, you may need some tail up tension to anterior pelvic tilt or posterior pelvic tilt. I'm also going to maintain a slight position of keeping my left hip down because that's the side that likes to hip hike. With you, you may have to create a hip hiking correction on the other side. You may have to think about pelvic sway or pelvic translation front to back. You have to place your spine in that unique exact position where it's less likely to irritate the disc, and that's done through an analysis of how posture and movement in your postural flaws and asymmetries and muscle imbalances relate to the way you put pressure on your disc and irritate it. This is all done through a good analysis. So with that said, I'm going to maintain that multifidus correction or contraction as I draw my lower abdomen into it. And I'm going to stand on one leg. I'm going to pick up the opposite leg. Now, if you want to, you can hold on for a little balance to something. And as I do that, I'm going to hip hinge or rotate my entire pelvis forward, allowing my upper body to move with it, making sure I'm not changing the curve in my lower back. And as I come forward, I'm going to make sure I maintain that connection of the muscle into my thumb. I'm going to make sure I have that contraction. If at any point I lose that contraction, I have to stop, re-engage my lower abdomen in, or any other multifidus contraction technique that you've learned to maintain that tightness, and I'm going to stop, readjust that, make sure I get the multifidus engaged again, then come back up and start the range of motion over. At a certain point, you may find that a distance or range of motion, you lose the multifidus. You want to work within the boundaries that you can maintain the multifidus contraction. The big thing that we choose with one-legged hip hinges is that when we stand on one leg, we have a tendency to hip hike, meaning the hip wants to come up into the ribs or the ribs want to fall in. And very often, people with multifidus weakness on one side, it's correlated to a tendency to hip hike or side lean or laterally flex to that side in their posture and their movements. These people have developed an overactive lateral flexion strength on that side, the quadratus lumborum, erector spinae, external oblique muscles of the abs, so that they're stronger in bending to that side than they are the other. And if you watch them walk and squat and lunge, that hip will have a tendency to swing up more than the other side. When we stand on one leg, that challenges this ability, because when we stand on one leg, the body wants to be lazy and it wants to hip hike. That hip wants to shift up. So maintaining level hips and level ribs, where we have an equal distance between the bottom of the rib cage and the pelvis, is the key when we're doing this exercise. That's going to be very difficult for someone that hip hikes and laterally flexes on one side with a multifidus that's weak. So this is a great way to retrain that whole system, not only engaging the multifidus, but making sure globally the pelvis is held in correct alignment and the rib cage is. The other thing that many times happens with a hip hiking tendency on one side is the pelvis likes to sway away from that side. That's due to external rotation tendencies of the leg that develop in the hip joint. So the other thing you want to think about as you maintain that multifidus is, as you come forward, make sure that your pelvis isn't drifting away from that standing leg. Turn the front of your pelvis into that standing leg so that you're maintaining a flat contour as you do this exercise. So you can do this very slowly over slow ranges of motion, maintaining the multifidus contraction in your finger, making sure you're not hip hiking or leaning in or rotating your pelvis. And as time goes on, you can use further and further distances of hip hinging coming up and down. You can repeat this for high repetitions to train the endurance ability of the multifidus, because endurance for the multifidus is much more important than pure strength training, which we reserve for larger low back stabilizing muscles. If you like this video on multifidus training and one-legged hip hinging, feel free to subscribe to our channel. We've got a lot of great videos out there to help you. Questions or comments, write in. As always, I'll do my best to answer. And remember, if you're looking for a great program to figure out what your unique mechanical issues are, how to do a self-analysis on yourself, your muscle asymmetries, what is your unique neutral spine, how do you find it, how to treat yourself to a systemized program of rehabilitation at home, and how to step-by-step put that into a fitness routine to build up the stability of your back, get you back into sports and fitness, and decrease your pain, check out our Fast Track program for degenerative disc disease at painfreeandfit.com. It's applicable to herniated and bulging discs as well, because once a disc bulges and eventually herniates, it starts to undergo a degenerative process. So bulging, herniation, degeneration is just different stages of the same problem. These exercises and the Fast Track Degenerative Disc program would be great to help you design a program to help yourself. I hope this video on multifidus training with one-legged standing hip hinging helps you with your chronic lower back symptoms.